Hi, I'm Louise Johnson. I'm one of the health visitors in the North West team.
I'm Lorraine Burn. I'm one of the health visitors in the North West team.
I'm Sarah Hall and I'm a health visitor at the Central team based in North Shields.
And I'm Abby Edminson, a newly qualified health visitor that's also based in the North Shields team.
What I really love about being a health visitor is that it's a privileged role. You get to see lots of different families at a very vulnerable stage of their life where they're transitioning into parenthood, and it's wonderful because you get to follow them through and see how they're developing.
I really like building relationships with the families that I work with. It's really nice that we've got continuity, that we are named health visitors for families and we build up relationships with those families. It's really nice to make a difference and support people at vulnerable times, and I really like the variety in the role as well because we do different things every day and it's always really interesting and gets going.
Yeah, so one of the things that we are quite passionate about here in North Tyneside is being inclusive of the co-parents as well, and only recently we've developed a programme of an app where dads or co-parents can access the information on there, and it's a lot more designed for them and the type of questions that they might have.
I'm also very passionate about the infant feeding team that we have within North Tyneside Council. It's made up of infant feeding coordinators that provide breastfeeding support to families that are struggling with any sort of feeding methods, and they provide support with latch, positioning and also any emotional wellness support as well.
So we're co-located with the family partners. We also have the safeguarding team really close by, so if we ever need to ask for advice of our colleagues, they're there and we can get the support of the families faster. Also the support that you get from working in the locality teams is great. Everybody's really supportive and we all enjoy our job and we're really positive.
We've got a lovely team down in the Central team and we do lots of sociable activities. You've got that opportunity to have a bit of a laugh and a giggle with your colleagues, can just have a huge impact on how you are mentally dealing with your day. So I would say for me it's definitely the colleagues who I work with who make every day enjoyable. Coming into work is a pleasure. I look forward to seeing everybody.
We've got a really good team here. It's a really friendly place to work. Enjoy coming in every day. The team is really supportive. Everybody will help each other out if you need anything, or if you're having a bad day, there's always someone there to listen. And I feel like I've always been supported really well by the management team here as well.
I think one of the benefits that North Tyneside Council also offers is the flexibility and the open access to the drop-in clinics that are run for families in the area. There's a clinic available in most days of the week in all the areas across the borough, and I think it gives open access to all the families that are working full time and also have grandparents that are bringing their children as well.
So health visiting isn't about just weighing babies, but we do go and spend time with families listening to any support needs that they have and signposting the right service for them, whether that be mother and baby groups or clinics.
Really love building up those relationships, doing things like breastfeeding support. I find that really really rewarding when you can see somebody through a journey which might be difficult at the beginning, and then you see them come out the other end, happy and doing what they want to do.